Welcome back to the deep dive. Today we're tackling, well, a really complex one. You've brought in some great source material on porphyria.
That's right. It's a group of rare disorders, often confusing even for doctors.
Exactly.
Sure.
So our mission basically is to simplify this. We want to break down porphyria, look at the symptoms, and figure out why it gets missed so often.
It was a critical topic.
And before we dive in, just a quick note for everyone listening. If you find this kind of deep dive helpful, you should definitely check out Mind Expansion Daily. That's where you'll find loads of great info like this.
Good point.
Yeah, and please like and subscribe to Mind Expansion Daily while you're there. Join the community. We explore all sorts of rare conditions and wellness topics.
It's a great resource.
And look, if you really appreciate the work we put into digging through these sources and making sense of them, maybe consider buying us a coffee. The link's right there in the description. Every little bit helps us keep this going.
Absolutely.
Okay, so porphyria. Let's start at the beginning. What actually is it?
Right. So fundamentally, porphyria isn't just one disease. It's a group, a family, really, of rare disorders. And what they all have in common is that they mess up the body's ability to make heme.
Heme. That sounds important.
Oh, it's critical. Heme is a key part of hemoglobin, the stuff in your red blood cells that carries oxygen everywhere. No heme, or not enough heme, means big problems with oxygen transport.
So like a fundamental breakdown in the body's chemistry. And how many people are we talking about? The number seemed quite significant for a rare condition.
Well, rare is relative, I suppose. The sources suggest around 200,000 Americans have some form of it, which isn't insignificant, you're right.
But here's the kicker, right? The misdiagnosis rate. That's what really stood out to me.
It's staggering. The data points to 60%. 60% of cases are initially misdiagnosed.
60%. And that pushes treatment back by, 2 to 5 years?
Exactly, 2 to 5 years. And when we get into the types of attacks porphyria can cause, you'll see why that delay is just, well, it's incredibly dangerous. It's not just academic curiosity. It's about preventing real harm.
Okay, let's use that analogy from the source material then. The broken heme factory. I think that helps picture it.
It's a good one. Imagine your body has this assembly line specifically for building heme. It's complex, lots of steps. Porphyria happens when one of the machines on that line, an enzyme, is broken or missing, usually because of a genetic issue.
So the factory tries to make heme, but it can't finish the job because a key step is broken.
Precisely. The assembly line gets jammed up, but the raw materials, the precursor chemicals, porphyrins, and their building blocks, they keep coming.
And they have nowhere to go.
Right. So they just pile up like a toxic sludge building up in the factory. And it's that toxic buildup that triggers all the symptoms we see. The pain, the neurological stuff. Everything.
That makes sense. The severity comes from how much sludge builds up, essentially.
Yeah.
And those acute attacks you mentioned.
Yeah. The acute attacks, often called neurovisceral attacks, happen when the system gets completely overloaded with these toxic precursors. And they are serious. Our sources say they can be life-threatening in about 10% of cases.
10%. So getting the diagnosis right and quickly is literally life or death sometimes.
It really can be. Immediate correct treatment is needed to stop that toxic surge.
And there's actually an economic angle here too, isn't there? The cost of not diagnosing it quickly.
Huge. Yeah, the sources mentioned some interesting data from 2024. Efforts focused on earlier diagnosis actually managed to cut hospitalizations by 15%.
15%. That translated to, what, $200 million in savings?
Roughly, yeah, or around $200 million. It just shows that awareness, getting this information out there, it's not just good medicine, it's good economics. We pay a high price when we mistake this for, just bad anxiety or a stomach bug.
Which brings us right to the symptoms. This is where it gets so tricky, because they really do look like other things.
They're masters of disguise, absolutely. That's why the misdiagnosis rate is so high. How do you connect, say, severe stomach pain with skin blistering after being in the sun? Or with sudden confusion?
It seems random.
It does, but it's all linked back to that toxic sludge hitting different parts of the body. The gut, the nervous system, the skin. Doctors often treat the symptom they see first, like IBS or maybe eczema, without digging deeper for that underlying enzyme failure.
Okay, so let's break down the main ones. We pulled out what we called the 7 out of 9 key effects. These seem to cover, 80% of cases? You really need to know these.
Definitely. They're the big flags.
Number 1, and this seems huge, severe abdominal pain. Affects 80% in the acute types, like AIP, acute intermittent porphyria. And it's not just a cramp, right? It's described as severe, constant.
And crucially diffuse. It's often all over the abdomen, not in one specific spot like appendicitis or gallbladder pain usually is.
And that's what throws doctors off.
Exactly. Surgeons might even do exploratory surgery and find nothing wrong, leading them to think it's, well, psychogenic or just extreme anxiety.
Hmm.
And boom, there's your 2 to 5 year delay starting right there.
Okay. Number 2, nausea and vomiting. Pretty common, 70% during those acute attacks.
Mm,
Again, easy to mistake for something else.
very easy. Food poisoning, stomach flu.
Then switching gears a bit, number 3, photosensitivity. This sounds dramatic. Skin blistering, pain, even scarring after sun exposure.
Yeah, really dramatic. This affects about 70% of people with the cutaneous types, especially Porphyria cutanea tarda, or PCT.
So connecting this back to the factory analogy.
Right. If the toxic sludge builds up mainly in the nerves and gut, you get the AIP-type symptoms like pain. But if it builds up heavily in the skin, it reacts chemically with UV light from the sun.
And literally damages the skin.
Destroys tissue, yeah. It's a direct chemical burn, essentially, triggered by sunlight.
Wow. Okay, what else? Number 4 was fatigue, like real exhaustion.
Affects about 60%. It's that deep systemic tiredness that comes with chronic illness when your body's under constant stress.
Makes sense. Number 5, neurological issues. This sounds scary. Confusion, maybe even seizures.
Yes, in about 20% of AIP cases. It shows how the nervous system is directly affected by these toxins.
Number 6, mood changes,
Mhm.
anxiety, depression, mentioned in 40% of patients.
Which, again, can be easily dismissed or misattributed, especially if there's also severe pain.
And finally, number 7, weakness, like muscle weakness.
Yeah, significant muscle weakness, affecting about 50% during acute episodes, can even progress to paralysis in severe cases.
Okay, that's a powerful list of 7. But you mentioned there were 2 more sort of nuanced points that often get missed but can be key.
Exactly. These are the ones that, if spotted, can really help crack the case when everything else seems confusing.
What are they?
First, red urine. This happens in about 30% of AIP patients. But the really specific detail is that the urine often darkens, sometimes turning reddish or brownish after it's been exposed to light for a while.
Like a chemical reaction happening right there.
Pretty much.
Yeah.
It's a visible sign of those porphyrin precursors being excreted. Second is heart palpitations, affecting maybe 20%. This is often tied to the autonomic nervous system being disrupted by the toxins.
So if you see that weird combination, severe belly pain, maybe the red urine clue, maybe some sun sensitivity, that's when porphyria should jump way up the list of possibilities.
Absolutely. It paints a much clearer picture than just looking at one symptom in isolation.
And this also helps explain the different types of porphyria, right? How can the same basic factory problem lead to such different main symptoms?
It often comes down to which enzyme is broken along that assembly line and where the specific precursors tend to build up most, and also what triggers an attack.
So let's contrast the 2 main ones mentioned, AIP and PCT.
Okay, acute intermittent porphyria, AIP. This is mostly neurological. Think severe abdominal pain, confusion, seizures, weakness. It tends to hit women harder, about 60% of cases, and attacks are often triggered by things like hormonal changes, certain drugs, or dieting. Its prevalence is maybe 1 in 20,000.
Okay, mostly nerve and gut related. Then Porphyria cutanea tarda, PCT.
PCT is almost entirely about the skin, that photosensitivity, the blistering. It's more common, maybe 1 in 10,000. And while there's often an underlying genetic predisposition,
So environment plays a bigger role here.
a much bigger role in actually triggering the symptoms. Things like alcohol consumption, having too much iron in your body, infections like hepatitis C, or even estrogen use can really set PCT off. It causes the porphyrins to build up in the liver and then the skin.
Got it. So understanding the causes and triggers, that's our section 3, is vital for managing it. You mentioned genetics and environment. What's the split generally?
The sources suggest around 80% of porphyria cases have an inherited genetic component. It can be autosomal, dominant, or recessive, depending on the specific type.
But that leaves 20%.
Right. The other 20% seem to be primarily triggered, or at least significantly worsened, by those external factors we talked about. Certain drugs, alcohol, smoking, infections, stress, fasting.
So even if you have the genetic tendency, avoiding your specific triggers is huge.
It's probably the most powerful day-to-day management tool for many people. Avoiding triggers can potentially keep that faulty factory running smoothly enough to prevent major pileups.
And the consequences of not managing it, of letting it go untreated, they sound severe.
They are really severe. We mentioned the risk of respiratory failure during acute attacks, about 10%. That's due to paralysis of the breathing muscles.
Terrifying.
Yeah. For PCT, because the liver is often involved in storing those excess porphyrins, there's about a 15% risk of serious liver damage, even liver cancer, over time.
And the pain.
For those with recurrent acute attacks, chronic pain becomes a major issue for maybe 30% of them, just constant debilitating pain. And finally, the kidneys take a hit too from filtering all those toxic chemicals, about a 10% risk of developing significant kidney issues.
Okay, it's crystal clear why fast, accurate diagnosis is so important. How do they actually confirm it? What are the tests?
It usually starts with looking for that biochemical evidence, the sludge. Blood and urine tests are key. They can detect high levels of porphyrins or their precursors in about 90% of active cases.
90%, that's pretty definitive.
It's a strong indicator. Then, genetic testing can pinpoint the specific faulty enzyme gene in about 80% of cases, confirming the exact type of porphyria.
And for PCT, anything specific?
Yeah, sometimes stool tests are helpful for PCT because specific types of porphyrins tend to accumulate in the gut and are excreted that way.
Okay, diagnosis seems achievable if you know what to look for. What about treatment? Is there hope once you have a diagnosis?
Definitely. The treatments are quite targeted, going back to that factory analogy.
How so?
Well, for those life-threatening acute attacks, the main treatment is giving hemetin intravenously. Hemetin is basically a form of heme.
So you're giving the body the finished product it can't make.
Exactly. It tells the body, okay, we have enough heme now. You can slow down the start of the production line, which stops the buildup of those toxic precursors. It's effective in halting attacks in about 65% of cases.
Okay, that's for the acute neurological types. What about PCP, the skin type?
Totally different approach. Since PCT is often linked to iron overload, the main treatment is surprisingly simple. Phlebotomy.
Like bloodletting.
Basically, yes. Regularly removing blood lowers the overall iron levels in the body. This helps the liver process porphyrins better and reduces the amount spilling into the skin. It helps about 70% of PCT patients see significant improvement in their skin symptoms.
And then there's just managing the triggers, right?
Absolutely critical. Simple lifestyle changes, carefully avoiding known triggers like specific drugs, alcohol, sun exposure, whatever applies to your type. That alone helps around 50% of patients manage their condition effectively, sometimes without needing frequent medical treatments.
That story you mentioned, Christina Hale, seems like a perfect example of that working.
It really is. Years of misdiagnosis, terrible abdominal pain, those skin blisters, dismissed as psychological, finally gets the PCT diagnosis in 2023.
And then?
Through phlebotomy to get her iron down and being super careful to avoid alcohol and minimize sun exposure, her main triggers, her quality of life, improved dramatically. Her story, which she shared publicly in 2024, really highlights how diagnosis plus trigger management can give people their lives back.
It underscores the power of awareness, which is kind of the whole point here.
Exactly.
And those awareness campaigns we talked about earlier,
Mm-hmm.
reaching 4 million people, boosting screenings by 15%,
Mm-hmm.
that's not trivial. That's thousands of people potentially avoiding years of suffering and dangerous delays.
Thousands. And looking bigger picture globally, estimates suggest maybe 300,000 people have porphyria. In the U.S. alone, the projections are that if we just get better at recognizing these signs, become more vigilant.
Like we're trying to encourage right now.
Precisely. We could prevent maybe 20% of the really serious complications, the liver damage, the kidney failure, the chronic pain.
And save potentially $500 million by 2030, according to the source data.
The return on investment for just paying attention and knowing the signs is huge.
So the big takeaway for you listening, porphyria is complex, yes. It hides well. But being vigilant, recognizing those key symptoms, especially the weird combinations.
The abdominal pain plus the red urine plus the sun sensitivity.
Right. Recognizing that pattern is incredibly powerful. It can dramatically cut down the risk of those severe, even life-threatening attacks.
It really can make all the difference.
Okay, before we wrap up with our final thought, let me just remind you again, if this deep dive was useful, please visit Mind Expansion Daily for more content like this. Like, subscribe, become part of the community.
Yeah, definitely do.
And if you feel like supporting this work, the link to buy us a coffee is in the description. We genuinely appreciate it. Now, let's quickly recap those 7 main effects we covered.
Okay. Severe abdominal pain.
Nausea and vomiting.
Photosensitivity, the skin reactions.
Fatigue, that deep exhaustion.
Neurological issues like confusion or seizures.
Mood changes, anxiety, depression.
And muscle weakness.
Got it. So here's something to chew on, our final provocative thought for you.
Okay, so we know 60% of patients get diagnosed late, like 2 to 5 years late, because the symptoms look like other common stuff.
Right.
So the question is, forget fancy new tests for a moment. What specific, maybe low-cost process changes could a local hospital or just your average GP's office put in place to use those really distinctive clues we talked about, like the urine darkening with light or that specific type of non-localized abdominal pain combined with other signs to catch porphyria much earlier? How do we get that 2 to 5 year delay down to, say, under 6 months just by being smarter with the clues already there?
That's a really practical challenge. How do we change the system's approach? Food for thought indeed. Thank you for joining us on this deep dive into the complexities of porphyria.
Thanks for listening.
We really want to hear from you. Leave a comment. Did you agree with our summary? Disagree? What stood out to you? And please, tell us where you're listening from. We're trying to build this community worldwide. Catch you on the next deep dive.